Hello everyone, my name is Molly Walters and I will now be discussing how to begin preparing early for the NAPLEX and MPJE/UMPJE exams. Although licensure exams may seem far away during your P3 year, the habits you build now can make board preparation more manageable during your P4 year and after graduation. Rather than cramming at the end of pharmacy school, consistent learning throughout your curriculum strengthens long-term retention and reduces stress. By the end of today's presentation, you should be able to describe the purpose of the NAPLEX and MPJE or UMPJE exam, develop a long-term study strategy that begins during your P3 year, identify study techniques that are supported by effective study habits, and select appropriate board preparation resources. NAPLEX, shortened for North American Pharmacist Licensure and Examination, is designed to determine whether a pharmacy graduate has the knowledge and skills needed to practice safely and effectively as an entry-level pharmacist. The competency statements emphasize pharmacotherapy, patient assessment, calculations, compounding, medication safety, and drug information. The examination focuses on applying knowledge rather than simply recalling isolated facts. This is thought of as the bread and butter of pharmacy, as it is focused on ensuring pharmacists can demonstrate their medication expertise. The MPJE or UMPJE, depending on your state, evaluates pharmacy law, including federal law and state-specific law, where applicable. It also assesses your professional judgment and application of legal principles in pharmacy practice. The uniform MPJE or UMPJE is being adopted by states every year, so make sure to look at the NABP website to see whether your state is accepting the MPJE for licensure or if they are still utilizing their own state-specific MPJE. Success on this exam depends on understanding how legal concepts apply in pharmacy practice and being able to make sound judgment calls. It's very important to start studying early because starting to study for your board exams during your P3 year helps reduce the amount of material that must be reviewed during your API rotations when you're super busy and also after graduation when you're stressed in trying to prepare for your exams in a short time period. Early review reinforces classroom learning and improves long-term retention because it allows you to have more exposure to the content for a longer period of time. It makes dedicated board preparation less overwhelming because you're able to split up the information into more manageable chunks, and it allows you to identify weak areas early so you can address them prior to the exam. Your study preparation timeline may look different, but this is a nice little template to help guide your studying. During your P3 fall semester, begin identifying topics that you consistently found difficult during your lectures. You don't need to study every subject equally, but focus your extra time on areas where you struggle. For example, my struggle areas are diabetes management and infectious disease, so I know that I need to really focus on that in preparing for my licensure exams. During P3 spring, continue reviewing therapeutics while strengthening your pharmacy calculations and beginning to review your pharmacy law. So now that you're moving away from more content, you're going to start applying that in a more situation-based setting. Then during your API rotations, every patient you encounter will become an opportunity to review. If you see a patient with heart failure, spend a few minutes reviewing the current ADA/HA guidelines or medication recommendations for how to treat HFpEF or HFrEF. Completing practice questions each week also helps reinforce what you've learned during your API rotations. Once you've graduated, you've officially become a PharmD, you can shift into a more structured review schedule that uses one comprehensive review resource, and you can start doing full-length practice exams to get a feel for how quickly you need to answer each question for the time allotted. During the final few weeks prior to your exam, focus on calculations, pharmacy law, and any remaining weak topics rather than trying to completely learn new material entirely. These 6 habits are supported by educational research and they can help make studying much more effective for you. First, study consistently. Short, regular study sessions are generally much more effective than waiting until the last minute and trying to study for several hours at one time. Second, complete practice questions regularly. Practice questions don't just test your knowledge, they also help you identify areas that need more review. Third, use active recall. Instead of simply rereading your notes, close your book and try to explain the concept from memory alone. That process strengthens learning because you're actively retrieving information instead of just having it handed to you. Fourth, review calculations regularly. Calculations are a skill that improves with repetition, and practicing them consistently helps build both speed and confidence. Also, there are a lot of calculations questions on the NAPLEX exam, so it's important to feel very comfortable answering them in a timely manner to ensure you fit all of your questions in the time limit. Fifth habit is to learn from every API rotation. Every patient case, guideline discussion, and medication recommendation reinforces concepts that could appear on the boards. Finally, don't neglect personal wellness. Adequate sleep, regular exercise, and managing stress all improve concentration and learning, and it helps you stay mentally motivated throughout this long stretch of studying. There are many board preparation resources available out there, and it can be overwhelming trying to decide which ones to use. Rather than collecting multiple review books, it's often more effective to choose one comprehensive review resource and learn it well. Get to know the ins and outs of how that review resource is structured and how the information is presented. One great example is RxPharmacist. RxPharmacist has a ton of online study guides, content lectures, and practice exams for the NAPLEX, state-specific MPJEs, and the UMPJE. You can also look at the NAPLEX competency statements published by NABP because it can help you outline the knowledge and skills that are going to be tested on the exam. It also gives you a great breakdown of how many questions are assigned to which competency statement. The same can be true for the MPJE and UMPJE. These competency statements are also available on the NABP website, and it helps break down what is going to be tested over. For pharmacy law that uses state-specific MPJE, utilize your state board of pharmacy resources. But regardless, you're going to need a good universal MPJE review source that looks at the federal law, regardless of whether your state uses state-specific MPJE or UMPJE. Also, don't overlook resources you already have. You've already paid so much money and spent so much time through pharmacy school learning from your faculty and sitting through lectures. So include your class notes, your school review sessions, and your clinical practice guidelines and practice exams in your studying. Remember, using more resources doesn't necessarily mean you'll be better prepared. Consistent review of reliable resources is much more effective because it helps ensure that you're understanding the content flow and the information. This is a list of high-yield topics that appear frequently throughout pharmacy practice and will likely appear on your board exams, so they are worth reviewing consistently. Disease states such as infectious diseases, cardiology, diabetes, oncology, and anticoagulation are common because pharmacists encounter them regularly in clinical practice. You should also be comfortable with renal dose adjustments, pharmacokinetics and drug interactions, compounding regulations and standards, immunizations, medication safety, pharmacy law, and calculations. Rather than trying to memorize every detail, focus on understanding major treatment principles, guideline recommendations, and then apply that knowledge to your patient care. This is a basic study timeline that demonstrates how preparation will change as you move throughout pharmacy school. During your P3 year, your goal is to reinforce classroom material and strengthen those weaker subjects that you were just introduced to. This is when you should start to complete practice questions, but you can start with just a few questions a month to start getting the feel for how the flow is, and then you can gradually increase that amount as you progress. During your API rotations or your fourth year of pharmacy school, learning becomes more patient-centered, so you're actually applying that information, not just learning it. Every patient you care for will become another opportunity to review disease states, medication, and treatment guidelines. Increase the frequency of completing practice questions to at least once a week to really help reinforce the material. Once you've graduated, your focus shifts to comprehensive review, full-length practice exams, and identifying any remaining knowledge gaps. You should be completing practice questions every day to help improve your confidence and comfortability with the exam. By following this gradual approach, dedicated board studying becomes much less overwhelming. Many students make the same mistakes during board preparation, so it's really important that you try to avoid these mistakes. One is waiting until graduation before even opening a review book. Another is relying only on memorization instead of understanding why treatments are recommended. Understanding the why really helps that information stick. Some students avoid calculations in pharmacy law because they find them difficult, but avoiding weaker subjects usually make them more stressful later when you're cramming before your exam. Other students skip practice exams entirely, or they compare their progress on the practice exams to their classmates. Every student's progress is individualized, and you should only compare yourself against yourself, not others. Remember that everyone studies differently. The most effective study plan is the one that works for you. Also, don't neglect wellness. As stated earlier, making sure you're sleeping well, eating right, and staying active is super important to help your brain function, your comprehension, and your learning. There are several common myths students have about studying for their exams. The first is, I'll start studying after graduation. While dedicated review certainly happens after graduation, and you should be studying up until the day before your exam, students who reinforce concepts throughout pharmacy school often spend less time relearning material later. Another myth is that you need several different review books. In reality, one comprehensive resource that is of high quality and is structured and organized well, combine that with consistent practice questions, and that's usually enough. Some students believe that memorization alone is enough to pass the boards. However, both the NAPLEX and the MPJE or UMPJE emphasize applying knowledge to patient care rather than simply recalling that information. Some students think that API rotations don't help them prepare for the boards and that they can just be impeding their study time. In reality, every patient case and every clinical decision reinforces knowledge you'll need on the exam. Lastly, remember that not everyone benefits from the same study methods. What may help one person may be detrimental for another. It is important to stick to the methods that help you retain information the best. Now let's go over a few knowledge check questions. First question is, which study technique is most effective for improving long-term retention? A, highlighting lecture slides. B, reading the same chapter multiple times. C, active recall combined with spaced repetition. D, watching recorded lectures at 2 times speed. Or E, taking a practice exam after graduation. The correct answer is C, active recall combined with spaced repetition. While these are all potential study methods for you, active recall combined with spaced repetition is the one that will help improve long-term retention the most because you're reinforcing that information over a longer period of time and you're forcing your brain to remember information instead of just looking at that information. Also, taking a practice exam after graduation is a great idea. I highly recommend, but it's not going to improve your long-term retention. Now for the second question. Which resource should guide the content you study for the NAPLEX? A, social media study posts. B, random online flashcards. C, ADA diabetes guidelines from 2010. D, the NAPLEX competency statements. Or E, only your P1 lecture notes. The correct answer is D, the NAPLEX competency statements. These statements are produced by NABP, the governing body that hosts the NAPLEX exam and creates the exam, so it's very reliable and a very good resource to use to understand what content will actually be on the NAPLEX. Now for the last question. During APPEs, which activity best reinforces board preparation? A, memorizing drug brand names only. B, reviewing guidelines, asking clinical questions, and reflecting on patient cases. C, avoiding unfamiliar topics. D, waiting until after graduation to review clinical material. Or E, asking your classmates what they did during their rotation. The correct answer is B, reviewing guidelines, asking clinical questions, and reflecting on patient cases. All of these actions are a great way to connect the information you learned in class with real clinical practice. This will help the information stick in your head, and it will help you when you are answering questions for your boards. To summarize today's presentation, remember that board preparation should begin long before graduation. Every therapeutics course and every API rotation reinforces concepts that you'll eventually see on your licensure exams. Use active learning techniques rather than passive studying. Complete practice questions consistently, and identify weak areas early so that you have time to address them and feel more comfortable with them. Most importantly, remember that consistent preparation over many months is much more effective and much less stressful than trying to cram everything after graduation and right before your exam. Preparing for the NAPLEX and MPJE doesn't require studying every day for years. Instead, it requires developing good habits early and building on the knowledge you gained throughout pharmacy school. By studying consistently, using reliable resources, and taking advantage of your API experiences, you'll be much better prepared when it's time to take your licensure exams. You got this. I believe in you.